Hey everyone, and welcome to the Deep Dive. We're diving deep today into something that you might not have heard of before,
Hmm.
but it could be affecting you or someone you know.
Interesting.
It's called bile acid malabsorption,
Ah.
or BAM,
Am.
and it's
Okay.
often mistaken for other gut issues, but BAM can cause some really uncomfortable problems,
I see.
especially when it comes to diarrhea.
Yeah.
But don't worry, we're here to break it down for you.
Okay.
We'll explain what BAM is, why it happens,
Right.
and what you can do about it.
Sounds good.
And joining us to shed light on this often misunderstood condition is our expert on all things gut health.
Thanks for having me. You're right. BAM can be tricky because it often hides behind other diagnoses.
Right. So let's get to the basics.
Okay.
What exactly are bile acids and what do they have to do with our digestion?
Well, bile acids are like tiny superheroes produced in your liver.
Okay.
Their main mission is to break down fats in your small intestine,
Uh-huh.
so your body can absorb all the good stuff from the food you eat. Usually after they've done their job, they get reabsorbed back into the bloodstream
Okay.
at the end of the small intestine and recycled back to the liver.
Wow.
It's a pretty neat system.
That is neat. So where does the malabsorption part come in?
Yeah.
What causes the system to go haywire?
That's where BAM comes in.
Okay.
Sometimes those bile acids don't get reabsorbed properly and end up lingering in the colon,
Interesting.
which is the last part of your digestive system.
Yeah.
And let me tell you, those bile acids can be troublemakers.
Uh-oh.
When they're in the wrong place, they irritate the lining of the colon,
I see.
causing it to produce extra water, and you guessed it,
What's that?
leading to diarrhea.
Oh, so it's like those bile acids are causing a bit of a flood in the colon,
Yeah,
making things move way too fast.
exactly.
Yeah, not a fun situation.
Nope.
Especially when it happens chronically.
Right.
Now, you mentioned that BAM is often mistaken for other conditions.
Yeah.
Does that mean there are different types of BAM?
You're right on the money. There are actually 4 main types,
Really?
and each one has a slightly different cause.
Let's hear it.
Mm.
What are the different ways this bile acid party can get out of control?
Well, the first type,
Okay.
type 1 BAM,
Uh-huh.
happens when there's a problem with the ileum,
Yeah.
which is that final section of the small intestine
Okay.
where bile acids are usually reabsorbed.
Great.
This can happen because of conditions like Crohn's disease surgery or radiation,
Oh, wow.
all of which can damage the ileum and make it harder for those bile acids to get back into the bloodstream.
So it's like the absorption station is out of order.
Exactly.
Okay.
Then we have type 2,
Okay.
which is a bit more of a mystery.
Mm.
In this case, the liver just goes into overdrive,
Oh, no.
producing way more bile acids than it should.
Wow.
We don't know exactly why this happens,
Mm.
but it can overwhelm even a perfectly healthy ileum.
Wow, that's fascinating. So even if the recycling system is working fine, it can get overloaded.
Yeah.
What about the other two types?
Right. Type 3 is like a domino effect.
Okay.
It stems from other gut conditions that interfere with bile acid absorption, kind of like a chain reaction.
Interesting.
This could be celiac disease, chronic pancreatitis,
Mm.
or even an overgrowth of bacteria in the small intestine.
So it's like these other gut issues throw a wrench in the whole bile acid recycling process.
Exactly.
And what about the last type?
Type 4 is actually a side effect of taking metformin, which is a very common medication for diabetes.
Oh, wow.
So even if you don't have any other gut problems, this medication could be the culprit behind your BAM symptoms.
Wow, I had no idea that a common medication could cause this.
Yeah,
That's a good reminder that even seemingly unrelated things can impact our gut health.
definitely.
But it also makes me wonder if BAM can be caused by so many different things. How do you even know if you have it?
That's a great question.
Yeah.
And it's one of the reasons why BAM is so often misdiagnosed.
So let's talk about those symptoms.
Ugh.
What should people be on the lookout for? Besides the frequent bathroom trips, of course.
Right. Well, along with the watery diarrhea, folks with BAM often experience other not so fun things,
Like what?
like stomach cramps,
Oh,
that urgent feeling of needing to go end now and
The-
loading.
Oh, those gotta go moments are the worst.
Yeah.
And I remember reading that BAM can even lead to fecal incontinence, which sounds incredibly difficult to cope with.
It definitely is. Imagine the anxiety of not knowing if you'll be able to make it to the bathroom on time.
Oh, no.
It can make people avoid social situations or even just going out in public.
That makes sense.
Yeah.
It's so much more than just physical discomfort. It's the emotional toll
Yeah.
and the impact it has on your whole life.
Right.
And we can't forget about the potential long-term effects.
Definitely. One of the major concerns with untreated BAM is nutrient deficiencies,
Okay.
since bile acids help us absorb fat. BAM can lead to problems absorbing certain vitamins,
Like what kind of vitamins?
like vitamins that dissolve in fat, like vitamins A,
Uh-huh.
D,
Got it.
E.
A and B12.
Whoa, those are some important vitamins. What kind of problems can those deficiencies cause?
Well, vitamin D is crucial for strong bones.
Right.
Vitamin A is essential for good vision.
Yeah.
And vitamin B12 plays a key role in nerve function, among many other things.
Okay.
So over time, these deficiencies can lead to a whole host of problems if they're not addressed.
Wow. Okay, that's definitely something to take seriously.
Yeah.
So we've got chronic diarrhea,
Yeah.
potential for embarrassing accidents,
Right.
and even long-term health risks if it's left untreated.
Yes.
This is really making me realize how important it is to get a proper diagnosis. But how do doctors even figure out if someone has BAM? What kind of tests are there?
Well, it's not always easy, but there are a few different tests that can help pinpoint the problem.
Okay.
The gold standard is a test called the SACHCAT test,
What's that?
which involves swallowing a capsule
Okay.
and having some special scans a week apart.
Right.
It basically tracks how well your body is holding on to those bile acids. That sounds pretty high tech. But I read that it's not available in the U.S. Is that right?
Unfortunately, yes.
Okay, but don't worry, there are other options.
Yes, there are.
Okay, good. So what can people in the U.S. do?
Another option is the fecal bile acid test,
Okay.
which, as the name suggests,
Yeah.
measures the amount of bile acid in your stool. This one requires a special diet and collecting your stool samples,
Oh.
so it's a bit more involved. Well, it can be tricky, but there's this clever approach called an empiric trial.
Empiric trial.
And basically, it involves giving a medication called cholestyramine.
Oh, I've heard of that.
You have.
Yeah.
And you can think of it like tiny sponges
Oh.
traveling through your gut, mopping up those excess bile acids before they can cause any trouble.
So it's like a targeted cleanup crew.
Exactly. And if a patient sees a big improvement in their symptoms after a few weeks on cholestyramine, that's a strong sign that BAM is the issue.
I see. So essentially you're using the treatment to help confirm the diagnosis.
That's right.
That's pretty clever.
Mm-hmm.
Okay, so there are a few different ways to get to the bottom of this.
Yeah.
It sounds like something people should definitely bring up with their doctor if they're having any of these symptoms.
Absolutely.
But let's say someone does get diagnosed with BAM. What are their options?
Yeah.
Is there a way to treat it?
Yes, there are. The main treatment for BAM is a type of medication called bile acid sequestrants.
Bile acid sequestrants.
Okay.
That's a big word.
Yeah.
How do those work?
Uh-huh.
What do they do?
Think of them like tiny sponges
Oh,
that soak up those extra bile acids in your gut.
got it.
They bind to the bile acids, making them too big to be absorbed. So they just pass through your system and are eliminated in your stool.
So they basically neutralize the troublemakers before they can cause too much havoc in the colon.
Exactly.
That's great to hear. Are there different types of bile acid sequestrants?
Yeah.
What are their names?
There are a few common ones, such as cholestyramine, cholestyramine, and cholecystramine.
Okay.
They come in different forms,
Ah.
like powders, tablets, or capsules.
So there's some flexibility there.
Yeah.
That's good. But I've heard that some people don't love the taste or texture of these medications.
That's true. Some people find the taste or texture a bit unpleasant,
Yeah,
especially with the powders.
I can imagine. But I'm guessing if it helps with the diarrhea, it might be worth putting up with a little taste issue. Has that been your experience?
Yes, for many people, the relief from symptoms outweighs any minor inconveniences with the medication.
That's reassuring. And is medication the only option, or are there other things people can do to manage BAM?
Well, medication is usually the first line of defense,
Okay.
but lifestyle changes can also play a big role in managing symptoms.
Got it.
For example, since bile acids are primarily triggered by fat,
Yeah.
following a low-fat diet can be really helpful.
That makes sense. Less fat, less work for the bile acids to do.
Right.
But I'm sure a lot of people are wondering, what does a low-fat diet actually look like?
It's not as restrictive as you might think. It's about making smart choices
Okay.
and focusing on lean protein,
Uh-huh.
fruits, vegetables, and whole grains.
Okay, so it's about a balanced approach, not about eliminating all fat.
Exactly.
And there are some healthy fats, like those found in olive oil, avocados, nuts, and seeds, that are actually good for you.
Yes, those are all great.
This is great information.
Yeah.
It sounds like a healthy way to eat, even if you don't have BAM. I was reading that for many people with BAM, making these kinds of changes can really make a huge difference in their quality of life.
Absolutely. It's amazing to see how much people's lives can improve
Yeah.
once they get a proper diagnosis and start treatment.
Wow.
One study found that people with BAM who started taking bile acid sequestrants reported significant reductions in diarrhea and other symptoms, They even felt less anxious about going out and socializing.
That's fantastic. It really shows that there's hope and effective treatment can make a real difference.
It definitely can. And you know what's really fascinating
What's that?
is that researchers are starting to understand the role of the gut microbiome in BAM.
The gut microbiome, you mean all those tiny bacteria living in our gut?
Yes.
What do they have to do with BAM?
Well, it turns out that these little guys
Oh.
play a much bigger role in our health
Yes.
than we initially thought.
Okay, this is getting really interesting. So how does the gut microbiome connect to BAM?
Well, some studies are finding that certain imbalances in the gut microbiome
Interesting.
might actually increase the risk of developing BAM
Mm-mm.
or even influence how severe the symptoms are. It's like having the wrong mix of bacteria in your gut
Yeah.
can throw off the whole bile acid recycling process.
Whoa, that's mind-blowing. So it's not just about the liver and the ileum.
Right.
It's about this whole ecosystem of bacteria living in our gut.
Exactly. It's a complex interplay of factors, but understanding the gut microbiome's role in BAM is opening up new avenues for treatment and prevention.
This is so cool. And before we move on, I just want to recap what we've learned so far.
Yeah.
BAM, or bile acid malabsorption, happens when bile acids, those fat-digesting superheroes, don't get reabsorbed properly and end up causing trouble in the colon.
Right.
It can lead to chronic diarrhea, other uncomfortable gut symptoms, and even long-term health problems if it's not addressed.
That's a great summary.
And the good news is that there are effective treatments available, like bile acid sequestrants.
Yes.
And making some lifestyle changes like adopting a low-fat diet
Right.
can also make a big difference.
Absolutely.
And the research on BAM is constantly evolving, with new discoveries about the gut microbiome shedding light on potential new approaches to treatment and prevention.
That's so encouraging.
So if anyone listening is experiencing chronic diarrhea or any of the other symptoms we've talked about, it's definitely worth having a conversation with their doctor about BAM.
I couldn't agree more. Don't suffer in silence.
Exactly.
Okay.
You know, before we started this deep dive, I have to admit I had never even heard of BAM.
Oh, really?
But now that we've been talking about it, it seems like it could be way more common than people realize.
You're absolutely right. Remember how we talked about BAM? Yeah.
Often being mistaken for other gut problems,
Yeah.
especially IBS.
Right.
Well, some studies suggest that BAM might be present in a significant percentage of people who have been diagnosed with IBS-D,
Oh, wow.
which is irritable bowel syndrome with diarrhea.
Wow. That's pretty eye-opening. So many people struggle with IBS.
Yeah.
And to think that some of them might actually have BAM instead, or even in addition to IBS,
Right.
is a real game changer. It makes you realize how much we still don't know about gut health.
It really does. And it emphasizes the importance of listening to your body and advocating for yourself when it comes to your health.
Absolutely.
Yeah.
Now, we touched on how BAM can be caused by other gut conditions, like Crohn's disease or celiac disease.
Right.
Can you tell us a bit more about how those connections work?
Sure.
What's the link between these conditions and BAM?
Let's start with Crohn's disease.
Okay.
Crohn's is an inflammatory bowel disease.
That can affect any part of the digestive tract, but it often involves the ileum.
Right.
Remember, that's the crucial part of the small intestine where bile acids are usually reabsorbed.
Yeah, that's right.
So if Crohn's causes inflammation or damage in the ileum,
Okay.
it can mess up that reabsorption process, leading to BAM.
So basically, Crohn's can make it harder for those bile acids to get back to where they belong, and they end up wreaking havoc in the colon.
Exactly.
What about celiac disease? How does that tie into BAM?
Celiac disease is a bit different. It's an autoimmune disorder that's triggered by gluten, a protein found in wheat, barley, and rye.
Got it.
When someone with celiac disease eats gluten, it triggers an immune response that damages the lining of the small intestine.
Oh,
And guess what?
what's that?
The ileum, that superstar of bile acid absorption, is part of the small intestine.
Right. Yeah.
So if celiac disease damages the lining of the ileum,
Okay.
it can't absorb bile acids as effectively, and BAM can develop.
Okay, so in both cases, it's all about that ileum.
Exactly.
Whether it's damaged by Crohn's disease, celiac disease, or something else, if that part of the small intestine isn't working properly,
Right.
it can lead to BAM.
And it's not just those two conditions.
Oh, really?
Other things, like radiation therapy to the abdomen, can also damage the ileum and increase the risk of BAM. It really underscores the importance
Oh, wow.
of having open communication with your healthcare providers.
Yeah.
If you're facing any of these situations, don't hesitate to ask about the potential impact on your gut health.
That's a good reminder that it's always okay to ask questions and advocate for yourself.
Absolutely.
And speaking of questions,
Yeah.
I bet some of our listeners are wondering about surgery.
Hmm.
Could having surgery on your digestive system increase your risk of BAM?
That's a great question.
I'm sure a lot of people are curious about that.
The answer is yes.
Oh.
Certain types of surgery can definitely increase the risk of BAM.
So this makes me think, gallbladder removal.
Yes.
You said that it can actually increase the risk of BAM.
It's true. When the gallbladder is removed, the normal flow of bile is disrupted. So instead of having that controlled release of bile, it becomes more of a continuous drip. And that can overwhelm the ileum's ability to reabsorb all those bile acids, making BAM more likely.
Okay, so if you've had your gallbladder removed, this is definitely something to be aware of.
If someone has a significant portion of their ileum removed due to Crohn's disease or some other condition,
Okay.
they're more likely to develop BAM because they've lost a critical part of their bile acid reabsorption system.
That makes perfect sense. It's like if you take out part of the recycling plant, the whole system can get backed up.
Precisely. And some weight loss surgeries, like gastric bypass procedures, can also alter the anatomy of the digestive system and potentially increase the risk of BAM.
So it's not just the diseases themselves,
Right.
but sometimes the treatments for those diseases that can also play a role in BAM.
Mm-hmm.
It's all connected, isn't it?
It really is. Which brings us back to
Yeah.
the importance of being informed and having those open conversations with your healthcare providers.
I totally agree. Knowledge is power. Now let's shift gears a bit and talk about the experience of living with BAM.
Right.
We touched on some of the symptoms earlier,
Yeah.
but I'd love to delve a little deeper into how this condition actually affects people's daily lives.
Of course. As you can imagine, having chronic diarrhea
Yeah,
can be incredibly disruptive.
I can only imagine.
It can impact everything from
Yeah.
work
Yeah.
and social life
Yeah.
to travel
Wow.
and even simple errands.
In one of the sources we read, someone described feeling like they were always tethered to a toilet,
Right.
never knowing when an urgent bathroom trip might strike.
That's a powerful way to put it. It really captures that constant anxiety
Yeah.
and uncertainty that can come with this condition.
Right.
People with BAM might avoid going out, eating certain foods, or engaging in activities they used to enjoy
Yeah.
because they're afraid of having an accident.
It's a good reminder that these digestive issues aren't just about physical discomfort. They could have a huge impact on mental health and overall well-being. And then there's the issue of fecal incontinence, which
Yeah.
we talked about earlier. That must be incredibly challenging to cope with, both physically and emotionally.
It is. It can lead to feelings of shame isolation
Oh, wow.
and even depression. Some people might withdraw from social situations or become reluctant to leave their homes for fear of an embarrassing incident. It's so important
Oh,
to
no.
remember that these feelings are valid
Yeah,
and there's no shame in seeking support.
absolutely.
Yeah.
It's okay to reach out for help and talk about what you're going through. You're not alone in this. Now, I imagine that the severity of BAM symptoms can vary quite a bit
Yeah.
from person to person. Is that right?
You're exactly right. Some people might have occasional bouts of diarrhea,
Okay.
while others experience it almost constantly. The severity can depend on various factors,
Yeah.
including the underlying cause of BAM, the extent of ileal dysfunction, and individual differences in gut sensitivity.
And those variations in severity can also affect
Yeah.
how BAM is perceived and diagnosed right. That's true. Someone with mild occasional diarrhea might not even think to see a doctor about it,
Right.
while someone with more severe frequent symptoms
Yeah.
is more likely to seek medical attention.
And that's part of why BAM can be so tricky to diagnose. It's not always obvious, and the symptoms can mimic other conditions.
So for anyone listening who might be thinking, hey, this sounds familiar, what's the best course of action? When should someone talk to their doctor about the possibility of having BAM?
I would say if you're experiencing chronic diarrhea,
Okay.
and by chronic we mean lasting for 4 weeks or more,
Okay. 4 weeks or more.
it's definitely worth bringing up with your doctor.
Okay, so 4 weeks or more of persistent diarrhea is a red flag.
Yeah.
And don't be shy about mentioning any other symptoms you're experiencing,
Right.
even if they seem unrelated at first.
Exactly. It's always better to be safe than sorry.
Yeah,
And early diagnosis can make a big difference in managing this condition.
I completely agree. And it's important to emphasize that even if you've already been diagnosed with IBS or another gut condition, BAM could still be a factor.
Absolutely.
It's not an either situation.
Right.
BAM can coexist with other conditions, and it's worth exploring all potential contributors to your symptoms.
Absolutely. It's all about getting the full picture
Yeah.
and finding the most effective treatment plan for you.
Well said.
Okay.
One question we got from listeners is, how long does it take for those bile acid sequestrants to start working? What's the typical timeline for seeing improvement?
That's a great question. Most people start to see a noticeable improvement in their diarrhea within a week or two of starting bile acid sequestrants.
Oh, wow. That's pretty fast.
However, it can sometimes take a few weeks or even a couple of months to find the right dosage and achieve full symptom control.
So it's important to be patient and work closely with your doctor to find what works best for you.
Exactly. Everyone's body responds a little differently to medication.
That's true.
It's a process of fine-tuning and finding the right balance.
That makes sense.
Sure.
Now, here's another common question.
Okay.
Are there any natural remedies or supplements that can help with BAM? What's your take on that?
That's a question I hear a lot. While some people find that certain natural remedies or supplements like soluble fiber or probiotics can be helpful, the scientific evidence supporting their use for BAM specifically is still pretty limited.
So it's not a guaranteed fix.
Right. But that doesn't mean they can't be part of a holistic approach to managing BAM.
Got it.
For example, soluble fiber can help bulk up stools
Okay.
and might reduce diarrhea, which can provide some relief.
Yeah, that makes sense.
And probiotics, which are those beneficial bacteria for your gut, could play a role in improving overall gut health. But we need more research.
Yeah.
To understand their specific effects on BAM.
It sounds like it's worth discussing these options with your doctor, but don't rely on them as the sole treatment for BAM.
Exactly. It's always best to stick with evidence-based treatments
Right.
and work with your healthcare provider to create a comprehensive plan that addresses your individual needs.
Great advice. Now let's talk about stress.
Okay?
We know that stress can wreak havoc on our digestive systems. Can stress make BAM worse?
Absolutely. Stress is a major trigger for digestive issues,
Okay, it really is.
including BAM. When you're stressed, your body releases hormones that can mess with your gut motility and sensitivity,
Oh, no.
making your symptoms worse.
Stress is the worst. So what can people do to manage stress and minimize its impact on their gut?
Finding healthy ways to manage stress is so important.
I agree.
Things like exercise, yoga, meditation, spending time in nature. Whatever helps you unwind and de-stress can be incredibly beneficial
I love that.
for both your mental and physical health.
Those are all great ideas. Stress management is self-care, and it's essential for managing any chronic condition.
It really is.
Now, here's a question that might be on the minds of people who are thinking about starting a family.
Yeah.
Can BAM affect fertility or pregnancy? Is there a connection there?
While there's not a ton of research on the direct link between BAM and fertility,
Okay.
we do know that if BAM is left untreated and becomes severe, it can lead to nutrient deficiencies.
Right.
And those deficiencies, especially in key vitamins like vitamin D and B12,
Got it.
can potentially impact fertility and pregnancy.
So it's not BAM itself that's the main concern, but the potential consequences of not getting treatment.
Exactly. That's why it's crucial to get diagnosed and treated for BAM.
Right.
Especially if you're thinking about getting pregnant
Or
are already pregnant.
Great advice. Now, here's a big question that I think a lot of people want to know the answer to.
Okay.
Is BAM a lifelong condition?
That's a tough one to answer definitively.
Yeah, Beb.
It really depends on what's causing the BAM in the first place. If it's secondary to a treatable condition like an overgrowth of bacteria or a medication side effect, then addressing that underlying issue might resolve the BAM as well.
So there's hope for a cure in some cases.
There is. But if the BAM is due to a chronic condition like Crohn's disease or damage to the ileum, then it's more likely to be an ongoing condition that requires long-term management.
Okay, so it's not a one-size-fits-all answer.
Right.
But even if BAM is a lifelong condition, there are ways to manage it and live a full life.
Absolutely. And remember, research is always moving forward.
Yeah, that's true.
New treatments and better management strategies are constantly being developed. There's always hope for the future.
That's so reassuring to hear. Well, as we wrap up our deep dive into BAM, I think it's important to emphasize that this is a real condition that can significantly impact people's lives. But it's also a condition that can be managed effectively with the right diagnosis.
Definitely.
Treatment and support.
I couldn't agree more. If you're struggling with chronic diarrhea or any of the other symptoms we've talked about,
Yeah.
please don't hesitate to seek medical attention.
Good advice.
Getting the right information and support can make all the difference.
A huge thank you to our fantastic expert for sharing your incredible knowledge and insights with us today.
It was my pleasure.
And to all of you listening, thank you for joining us on this deep dive into bile acid malabsorption. We hope this episode has empowered you to take charge of your gut health and seek the help you need. Remember, you're not alone, and there are resources and people who care.